Hi, everybody. Welcome back to another episode of the Traveling Therapist Podcast. I am super excited today to have Liath Dalton here with us. She is, I guess, are you the CEO now, Liath, of Person Center Tech? Or I'm not even sure exactly.
Yeah, I am now the director of Person Centered Tech, which was founded by the late and very beloved Roy Huggins, his deputy director for 5 years, and then now wearing the director hat.
Oh my gosh. So if you guys don't know Person Centered Tech, they're basically like my go-to resource for everything tech related to being a therapist, really. I mean, it's an amazing resource. So definitely go check out their website. I'm going to put a ton of resources in the show notes that we talk about today. Before we hit record, I was telling Liath, I was like, I could probably talk to her for about 5 hours about everything she has to offer. And of course, we have limited time with this episode, but the thing I reached out to her about for this episode is the PHE, the crisis around the pandemic officially ending on May 11th, and then what May 12th holds for us. And Liath is really an expert on this topic. So I wanted to bring her in and have her just go over what this all means for us as therapists, and even, those of you that are listening to an insurance-based therapist and the traveling therapist. And just, I want you guys to be up to date with everything that's happening with this. And I couldn't think of anybody better than Liath to come in and talk about it. So thank you for being here.
It's a pleasure to be here, and thank you so much for the invitation. I obviously love talking about all of this stuff, and
Yes.
At a time when everyone's wanting to make sure that they are equipped with the information they need to be able to navigate the current practice landscape legally, ethically, all those pieces. We're happy to be able to share sort of the distilled version of what folks need to know, because obviously there are so many different information sources out there and you can get a little flooded and overwhelmed. So hopefully part of what we'll be doing today is giving you just the info you need.
Yes, thank you so much. So maybe you could just start with, what does this mean from May 11th to May 12th? Like what is the change that has happened for us to be aware of?
So it's not as massive as some of the anxieties around it would portend, right?
Yes.
At least in terms of cross-jurisdictional practice permissibility, the expanded cross-jurisdictional, like temporary practice provisions that were put in place during COVID were not tied to the federal public health emergency. Because permissibility to practice is done on a state basis, right? Because licensure is on a state basis. So permissibility to practice is also determined on a state basis. So the end of the federal public health emergency does not change how cross-jurisdictional practice works, and temporary practice provisions were not tied to the federal public health emergency. A lot of them were tied to the state level declarations of a public health emergency, or the governor's declarations. Each state had a little bit different terminology, but that piece has not shifted. And if you work with Medicare clients, the expanded provisions for telehealth coverage, where the requirement of being at a originating site are not being impacted either. That requirement has been done away with through the end of 2024, and it is very likely that that is going to remain in place beyond. There's a lot of demand for that flexibility to remain in place, because it has increased access to care. And as a result, positive care outcomes as well. So I don't foresee that piece going away either. And the audio only coverage under Medicare is also being continued at least through the end of 2024, as is the waiver of the requirement for an in-person assessment prior to a telehealth visit and then every 6 months. And I was just reading that a few days ago, there was legislation introduced to make that in-person requirement for telemental health services or mental health care services to also be waived.
Oh my gosh.
Right. Because that's one that everyone's been freaking out about, understanding.
Yes,
So
definitely.
if you have a remote only practice and no brick and mortar office, obviously that was causing a lot of concern, because how are you going to comply with that requirement? So we're glad to see that it looks like that's not going to be a barrier. So that's kind of the
amazing.
Medicare pieces. And then in terms of private payers, though, we do know that coverage is going to vary payer to payer, plan to plan. And so if you are an insurance-based practice, there may be impact on coverage, especially for out-of-network benefits, for coverage for telehealth. And really the primary determinative factor is going to be if you are in a state that has payment parity. So there's two types of parity. There's coverage or service parity and payment parity. Coverage or service parity is if a service is covered in person, if it's delivered in person, then it must also be covered if it is delivered via telehealth. Payment parity is the next piece, and what's most applicable here, which is that, and it must be reimbursed at the same rate as if it were delivered in person. And currently there are only 27 states with payment parity or a version of payment parity. There are like 4 of those 27 states kind of have some caveats within their payment parity. So honestly, it's really an area of opportunity for folks to advocate for payment parity. If you are licensed in or reside in a state that does not have payment parity, please connect with your local chapter of the professional associations and impress upon them how important payment parity is. And it really is important because it's not just about the providers being able to get reimbursed at a fair rate and continue to deliver services. That also then has implications for access to care and quality of care. So that is something that impacts the constituents, the residents in every state, and that should be a compelling reason for the lawmakers to get behind payment parity.
Yeah. Oh my gosh. Yeah. Just the other day, somebody in my Bill Like a Boss insurance billing membership came to me and said, why is my client having a $25 copay for telehealth, but if it's in person, it's no copay? She was totally confused by that. And that's brand new because she did call and check the insurance benefits with this new client. And they said, yeah, they're going to have a copay, for telehealth. So, things like that, have changed with the switch from the 11th to the 12th of May. The personal, the private insurance carriers, they're changing things up. So we have to be super careful right now to be checking our clients' benefits and paying attention to that. But also, like you said, doing the advocacy work if your state is one of these states, because it is going to interrupt client care. It's going to make it harder for them to get services, So if you're running into this stuff in your state, I don't know which states, I'm sure Liath could probably name the ones that have it and don't have it. But if you're running into this in your state, yes, please do the advocacy work. Reach out to your NASW or, legislative bodies and advocate and let them know how it's affecting client care, because, it worries me as an insurance-based provider or just a provider in general. Like, now that these things are lifted, like, what are the private insurance companies going to do with this? Are they going to make it harder to do telehealth and block access to care, because they're insurance companies, they like to do that stuff sometimes, So it's interesting. Yeah, gosh.
Yeah, I mean, there are paired with that a couple other pieces that are important to be aware of. Of course, one that PCT has been talking a lot about and had been for a good while prior to the expiration of the PHE was that the temporary notice of non-enforcement related to using video platforms for telehealth sessions that did not meet the requirements of the HIPAA security rule. Basically, services that you couldn't get a HIPAA business associate agreement with. Basically, at the beginning of the pandemic, the OCR, the Office of Civil Rights, who are the HIPAA administrators, said, we are not going to enforce this requirement. They didn't remove the requirement. They just said, we're not going to enforce it because people need to be able to, adopt a video platform in order to deliver care. Now that the PHE has ended, that period of discretionary non-enforcement has also ended, meaning you must be using a HIPAA compliance compatible video platform where you have a HIPAA business associate agreement with the service provider. That means that if you've been using FaceTime, that you cannot continue to use FaceTime. So it's important to make sure that you've got an appropriate platform and that you transition clients onto that appropriate platform. We know that there will be some clients who are like, oh, I love FaceTime. It works.
Yeah, I don't know how to use your link. Your simple practice link. I've got that issue going on right now. Yeah.
And so, we just want to make sure that you're using the right technology. And even beyond HIPAA, if you are seeing clients through insurance and you're paneled with insurance, oftentimes in your contract it will be the requirement that you are using a HIPAA compliant platform. So note that that's applicable as well. And then ethics codes and licensing rule regulations also had requirements about the security safeguards that were in place, right? Because protecting the confidentiality of client info is also an ethical mandate. So make sure you've got a good platform in place. And I always like to tell folks that it's good to have a solid backup video platform as well. And pro tip, if you use Google Workspace, which a lot of folks do, that's the paid version of Google, where instead of a @gmail.com address, you have your own domain name. You have to have your own domain in order to get a Google Workspace account. But the paid version of Google Workspace is really economical, but it gives you a business associate agreement, which covers a whole range of functionalities, including Google Meet, which is their video platform. And prior to COVID, it was not functionally robust, and we did not recommend it for video sessions, but it has been really bolstered and it works great. And we actually have a number of clients who use it as their primary video platform, including large group practices. So if you are looking for a primary platform currently, or you just want to have a good backup platform but not have to pay additional or add a whole other service into your practice's tech stack, you can, if you're a Google Workspace user, just use Google Meet. And there's a way to use Google Meet to create a static room link. So that you don't have to have a unique link for each appointment. And that then in effect gives you a waiting room too, because you have to admit entrance. So you don't have to worry about, if one session goes over or a client joins early, that you're going to suddenly have a big issue. So that's just a good tip for folks who are wondering about that component of things.
No, that definitely is. Yeah, thank you. So FaceTime is out, or is there any other ones that you could think of that people might be using that they need to stop?
Skype is out. The platforms that weren't acceptable during like the WhatsApp, I think WhatsApp was not. So you just, the rubric is you must have a HIPAA business associate agreement with the service provider.
Okay.
And there are, of course, lots of standalone platforms like VC and DoxyMe and VidHealth. But the other option, of course, is if you use a practice management or EHR system, they should have a built-in video, though those don't always offer as much functionality as the standalone ones, like the whiteboarding, or if you do couples and family sessions,
Right.
may not facilitate that well. So that's where the standalone platforms might offer more functionality there. Or Google also covers that.
Definitely. And I think what you said about it's just so important to have a backup, especially for us traveling therapists. I can't tell you how many times simple practices like failed on me, and I've had to go to Zoom, which uses a lot less bandwidth for some reason. So Zoom works a lot better for me in places where I have kind of spotty or not so great internet, you know?
Exactly.
I don't know if that's in my head, but it seems like that to me.
No, well, because how they are managing data works differently.
Oh, okay.
Because some of the platforms will be using what's called WebRTC, which is basically using the built-in video functionality within your browser. And then others are like a proprietary system, kind of where it's working in a different way. And so it's using less bandwidth. And the other thing to know is that your connection is always only going to be as good as the weakest link. So even if you have really great connectivity, if your client has really bad connectivity, the combination of the two is only going to be as robust as the weakest connection.
Yes.
So, and I should note, because I know a lot of folks have been using Zoom without a business associate agreement. I'd say that's probably more commonplace even than the utilization of FaceTime. So if you're using Zoom, you need to get the Zoom for Healthcare version where you can get the business associate agreement. Pre-COVID, you could only get a BAA with Zoom if you had 10 user licenses.
Oh, really?
It was $200 a month. Right? So thankfully that has now changed. So it is not cost prohibitive. So if you are using Zoom, love Zoom, want to keep using it, you absolutely can. You just need to get the version where you can get the BAA.
And you're making me think now, do I have that? I think I do.
You can just check,
I better check.
and make sure, because we actually had a client who reached out to Zoom customer support to upgrade, and they were like, oh no, you need the 10 user license one. Like, no, they are wrong. That's not the case. You can get it on an individual professional account now, which is way more economical. So you want to take that step. And then the other piece that has been clarified is that you must have a business associate agreement with your phone service provider as well.
Okay.
And that includes cell providers. So
interesting.
AT&T, T-Mobile, Verizon, etc. If you are using a phone service to communicate with clients in any way, and I'm not just talking about for audio only telehealth sessions, but to communicate with clients in any way, you must have a business associate agreement with the service provider. You can get that on the business plans with those kind of conventional cell carriers. It is more expensive though. So our usual recommendation is to use a HIPAA-friendly VoIP or voice protocol service, which has a lot more robust functionality anyway. It's dramatically more economical. And I'll share that our most frequent recommendation for a VoIP service is iPlum. That's like iPhone, and then plum like the fruit. And they have funny name, but it's a great service. And they have it does, voice calling, voicemail, but also has conventional texting, and then has secure messaging. So there's a free client facing app. And if they have that, any messages exchanged through the app are secure. So if your practice management system doesn't have secure messaging, or it just has a clunky secure messaging system and it's hard to get clients to actually use it, that's a good alternative there.
Wow.
So yeah, that's the big kind of news, because previously classic phone service was considered to be kind of outside the scope of the HIPAA security rule, where because the information was not electronic, you know, the business associate rule and HIPAA security rule didn't apply. But because even classic landline service now keeps electronic call records.
Wow.
And phone numbers are identifiers under HIPAA, that means they are maintaining PHI.
Wow. Yes.
Yeah. So that is a big change, but it isn't as scary as it sounds to have to get appropriate service on board, because any number that you control, you can port another service. So you do not have to worry that you have to change your phone number and then update it with clients and every one of the many places that it exists, right? Or is out there and being used. So it's not as onerous as it might sound at first glance to think, oh my gosh, I have to get a BAA with my phone service provider. That sounds like a nightmare.
Yeah. Okay. Wow. This is so interesting. Oh my gosh. Everybody listening, you might be freaking out, but like I said, I mean, I think if you just take these in little pieces, it can be manageable, trying to like make sure you're doing this stuff correctly, especially on the road and different internet connections and that sort of thing. You want to make sure you're secure and you're following.
Yes,
absolutely.
Yeah, I mean, the things we want to see are that you have your devices secured, because just about every therapy practice now, but especially if you're a traveling therapist, you're going to be a cloud service reliant practice, right? You're not lugging file cabinets around with you and keeping paper records, right?
Right.
You're likely keeping electronic records, and all of the info that you are managing for your practice, both for client care delivery and your own internal operations, is pretty much going to be in cloud services. When I like to say that makes you a SaaS-y practice, because the shorthand for software as a service, SaaS, I like to say you're a SaaS-y practice if you're cloud reliant. But you still have to ensure that the tools that you use to access those cloud services are secure. And that just means making sure you've got the necessary technical security measures in place on your devices that make them appropriate for accessing systems that contain client info, so that you're not introducing a vulnerability into those systems that could compromise PHI or result in a breach. And very importantly, that you also have safe harbor from HIPAA's breach notification rule in the event of theft or loss of a device that contains or has been used to access PHI. And it's not hard to get safe harbor in place on your devices, on any smartphone, tablet, laptop, or desktop actually as well. And then once you have those measures in place and documented as such, you qualify for safe harbor. Which if you're, a traveling therapist, that's really important, right? Because you do have increased risk exposure when you're traveling with all of your devices and going from place to place. And so I'd say it's even more imperative than the average, or more conventional brick and mortar practice where devices are staying put, that you make sure that you've got the peace of mind of knowing that you've got safe harbor in place.
Wow. And a lot of this stuff, Liath is actually going to come back and be a guest in the Traveling Therapist membership in August. And I really want to get more into the weeds specifically about how to do this stuff she's talking about right now in the membership when she comes in to present to the group. But this is so much information. And Liath, y'all do private consultations, right? And you have programs too to help people get set up with this. Yeah.
So
Okay.
our core services it's called Practice Care Premium, and we have a version for solo practitioners and a version for group practices. And it has our device security resources and our home and mobile workspace security resources as well. So that includes a device security center that has step-by-step device-specific tutorials for configuring each of those required technical security measures, a form for documenting that, because with HIPAA, it's always the documentation or it wasn't done. And then the Home and Mobile Workspace Center also has the step-by-step tutorials on how to configure your Wi-Fi network to be secure, or if you can't do so because it's not your own hardware, right, which is going to be more applicable for a traveling therapist, how to use a VPN, a virtual private network, which then makes it permissible to, basically it makes it safe and secure to connect to any network without potentially compromising your device. So it goes over how to utilize a VPN, or the other option is to use your cell phone's mobile, its data connection. And you can use the data connection on your cell phone without having a business associate agreement with the service provider, because it's handling info in a different way. It doesn't create a business associate relationship, so a BAA isn't needed. So all those are gone over in the the device security center and the home and mobile workspace center. And then that service that I mentioned that provides those accesses also includes our direct support and consultation services. We do weekly live and recorded webinars where we just answer whatever questions folks have.
Amazing resource. So I want to shift gears for a second, because before we hit record, we were also talking about something that's really important to traveling therapists. And that is, we're sitting in different states and different countries, seeing our clients that are back physically located in our state of licensure. But you were telling me there are some new things to consider about this. So I would love if we could talk about that a little bit and give some information to help the traveling therapist on this thing that we're doing.
Yes, absolutely. So, I think at this point, everyone understands the kind of basics of cross-jurisdictional practice, in that the primary jurisdictional authority is always going to be where the client is physically located at this time of session, right?
Right.
And then, of course, your licensure board or licensure boards, if you hold a license in multiple states, also have a right to govern how you practice and dictate what's permissible and not permissible. There's a third applicable or potentially applicable jurisdictional authority, which is the licensure board where you are physically located at the time of delivering care, right? So it's the client located, where are you licensed, and where are you as the provider physically located when delivering care. All three have the right to say something about permissibility of practice and specific requirements for how practice is conducted. So pre-COVID, it was exceedingly rare, like when we would talk about the three authorities that have the ability to dictate permissibility of practice, we would include the physical location of the provider, but would say, so far we haven't really seen anyone restricted. Theoretically, they can, but we don't have examples of that. Then the Maryland Psych Board did say, if you are delivering care from within our state, regardless of if the client is within Maryland, if you're a psychologist, you must be licensed by our board. And we're like, oh, wow, that's kind of wild. What does that mean? And it didn't apply to the master's level professions in Maryland. Then at the beginning of last year, so 2022, at the time of recording, we saw the Alaska boards put a restriction in place, which is that if you are delivering care from within Alaska, regardless of the client's location, you must be licensed by the Alaska board. So let's say, Kim, are you licensed in Alaska?
No.
Okay, so if you went to Alaska, you would not have legal permission to practice with your clients there. So you want to know this right before planning travels or considering your next destination. So that's now not just the case in Alaska, though, but is also known to be the case in Texas and in Oklahoma. I don't know if there are additional restrictions in place or forthcoming, but my conversations with the licensure boards is revealing that there is likely to be kind of an increase in this
oh my gosh
direction. So it's something to be aware of, and part of what you want to ensure you're doing is your due diligence to make sure that whatever place you are going to be physically located, that you do have permission to practice, that you aren't restricted from practicing, even if the clients that you are providing care to are not located in that state.
Wow. Now, is this for all licensure boards in Alaska, Texas, and Oklahoma that you know?
I know it's all licensure boards in Alaska. Texas and Oklahoma, I believe so, but I'm not at the time of recording, can't confirm that piece. I haven't read the comprehensive statutes for each license type yet. We are actually in the process of updating person-centered tax 50 state practice rules tool, and are adding in this component, because currently what it contains is the temporary practice provisions for licensure types, psychologists, clinical social workers, marriage and family therapists, and licensed counselors. But now we are also adding in if there's this type of restriction, and are putting in the payment and coverage parity info as well, just so it's a little bit more comprehensive of a resource. So
it's amazing.
We will be verifying that in each of the states that we're looking at. But for now, what we can offer is we've got a free due diligence permissibility to practice worksheet that includes the kind of rubric for determining what jurisdictions apply, including if you are not within a state that you are licensed in, if that's not where you're delivering care from, what that licensure board is, and is there a restriction or not, so that you can be guided through making sure you're checking what you need to and documenting it as such. And hopefully, I want to say what my own hope is, which is that we don't see a proliferation of this sort of restriction. I'm glad it is relatively small for the time being, but it does highlight the importance of just going through that due diligence process. And I think for your practice, when you're considering jurisdictional issues, it's really, you're not establishing new clients in states outside of your state of licensure, right? When you are having to check if you have temporary permission to practice, that's if the clients, your established clients who are located in your state of licensure or states of licensure, I know you hold multiple, that if they are traveling and want to have a session while they're traveling, that you're checking that temporary practice provision, right? Yeah.
And Liath actually shared that with me, her cross-state jurisdictional worksheet to walk you through this stuff and to keep it documented that you've checked it. Yes. And I will share that in the show notes. Liath, this might be a legal question. I know you work closely with Eric Strom, so I don't know if you guys have talked about it, but what happens when you're traveling to a state and you've reached out to the board, they do not give you an answer. Nobody gets back to you about whether you can work in that state or not. I mean, I know we have your guide we can look at for sure, but what if we can't get an answer and it's planned? Like, I'm going to Alaska for a month, and I mean, I know we're hearing this about Alaska now, but what if we can't get an answer from that state? What do you do? Do you not go? Do you not see your clients? The advice I was given was prove that you did your due diligence to try to get the answer and document that. But I don't really know. I thought maybe you'd be a good person to ask, like, what do you do if you can't get an answer?
The answer would be that you wouldn't practice, because I mean, the reality is that you can, without getting a yes or no from the licensure board, which different boards have different response time frames as well as response helpfulness.
Yes, definitely.
But the reality is that being able to determine that is going to be within reach, because it's contained, whether or not they have a temporary practice provision is contained in their rules and regulations, which yes, it's a pain to have to read through all of those, and it's a lot of legalese, but there is a way to get an answer of yes or no without having another human being have to answer the question for you. And so in my, from my risk averse perspective and wearing the kind of risk analysis hat, I would say that it would be difficult to make an argument that would hold up that you have done due diligence if you are practicing where you don't have permission to practice just because the licensure board didn't respond.
Good advice. I know
that's
the answer nobody wants to hear.
Want to hear. And I also want to share, there's another resource that's helpful in addition to the PCT resource, which actually comes in an app form.
Yes.
And that's the Epstein-Becker-Green tool. They're a big law firm, and they have a whole bunch of attorneys who are always researching this. And it's just called, let's see, let me look at it on it's just Telemental Health Laws. That's what the app is called. It's available for iPhone and Android. And that has what you want to be looking at within that, though, and this is a really important thing, because I've had folks who looked at in the state guides, and they've got all the states, and then they've got the profession types. You want to open it, look at your licensure type, and then it's not the scope of practice that you're looking at. That's what folks used to think, like, oh, is telehealth permitted or not? Are there restrictions on the scope of practicing teletherapy? What you need to be looking at is the licensing requirements section. And that will contain whether or not a temporary practice provision is in place, and it links directly, same as ours does, but it links directly to the relevant statutes or regulations, so that you can go do the extra step of verifying that that's current. Because even though Epstein-Becker-Green has a whole team of attorneys working on this constantly, we know rules and regulations change pretty quickly, or can.
Yes.
And so you want to be, when you're doing your own due diligence documentation, you basically want to be screenshotting directly from the rule source itself. So if you're using PPT's tool or Epstein-Becker-Green, that's your first step. In the due diligence process. You want to check for the yes or no, and then follow the link to the statute, verify that's current, and then screenshot that and save it along with the documentation worksheet.
Wow. Oh my gosh, so helpful.
And honestly,
Thank
I
you.
would say it can be a lot less painful to do the due diligence process that I just described than emailing the board and waiting, especially because sometimes you'll get someone from the board whose response will just be to link to their whole rules and regulations, not even
Yes, I've seen that.
one, or who will be kind of off put that you've asked them. Like we've seen instances of that too. Plus, you also could get someone who is truly just an admin and doesn't know
Mm-hmm.
the actual
Yes.
answer and
heard that.
give you an incorrect answer. And we've also seen that happen as well.
Wow. Oh my gosh, this is so helpful.
I'm
And this
so
is what I mean. I could talk to her for hours, but we're running out of time.
Yes.
So how do people reach out to you if they want to work with you? I know you talked about it a little bit with the programs that you offer, but what's the best place to go?
Absolutely. So if you just go to our website, which is personcenteredtech.com, and then in the top navigation menu, there's a start here option, and that there's one for solo practitioners and one for group practitioners or group practices, because the kind of specific resources are going to vary based on practice context there. But if you click on the start here, it'll walk you through what we offer, and there's also a tool that helps with needs identification for you, like where should I start specifically, what are my particular highest priority needs, and then it also has options for scheduling an info resource consult with me if you're a group practice owner. If you're a solo practitioner, our usual means of providing guidance is follow up. Our team reaches out to you after you use the little tool for needs identification and make sure you get the support that you need to identify the right place to start.
Wow. Oh my gosh, so helpful. Thank you so much. And I'm going to have Liath back, like I said, in the membership group that just launched this week. I'm so excited about it. But she's coming back in August, and we'll get more in the nitty gritty about this stuff. And there'll be like a live Q&A if you guys have questions and that sort of thing. So I'm really excited about that. And Liath, thank you so much. I love what you and Person-Centered Tech offer us, especially for traveling therapists. It's so useful. For those of you guys, I don't know if you're on my newsletter or not, but I have in the newsletter, I have a guide about how to navigate state to state stuff, and Liath's links are all in there too. Everything she was talking about, the 50 state guide that they offer, it's in there, so you can link right to it there, but we'll put it in the show notes too.
Awesome. Thank you so much for having me, Kim. And I am very much looking forward to that training and like you said, getting into some more of the nitty gritty and the like this is how you do it.
Yes, that's going to be so valuable. Thank you so much.
It's a pleasure. See you next time.
Okay, thanks. Bye.